Here with me now is someone who lives and understands the reality of what this virus is doing to people, to our medical system, Dr. Craig Spencer, our emergency room physician, director of global health and emergency medicine at Columbia University Medical Center. Dr. Spencer, we've had you on before. That video really brought me up short, and I wondered if you could just talk a little bit about what the human experience of going through this in a hospital ER has been like.
I've watched that video so many times. I was part of making that video, and still every single time that I see it, it almost brings tears to my eyes. I remember the patient and the family like it was yesterday, and it was about a month and a half ago. Look, we all want to move on to some semblance of normal, but this happened so many times every shift that we went to work, so many patients and families that we called over FaceTime so that they could say goodbye. I don't think any of my colleagues are ever going to be able to get back to normal. This is something that we didn't do on a daily basis. This was so hard and so impactful for all of us and for families who weren't there to say goodbye. So, yeah, it's still just really heavy. I mean, things thankfully have improved. We don't have the same case numbers, but I'm also afraid, like you, that everyone is comparing what's happening in Mississippi or Alabama to what we saw here in New York City. And the scale hopefully will never be the same. But it doesn't have to be as bad as New York or half as bad or as tenth as bad to be really, really, really bad. And I hope that no one has to experience what we experienced and what I tried sharing in that video.
You know, that you identify something that I think is it puts a finger on a kind of slipperiness in what our policy goals are here. And I think that there's one way of thinking about this is, can we go back to normal and avoid another New York City style meltdown? And I think the answer to that is different than the answer of how much can we go back to normal and spare needless death and mayhem to local hospital systems. Those might be two very different answers.
Yeah, well, I think that the answer to both of those, and really the approach to both of them, is bread and butter public health. The way that we need to be approaching this is, I hear a lot of discussion around, are we going to have a peak or a plateau? What's going to happen later this year? We don't know how many cases it's going to be, but there's going to be more cases. We are going to see this more in New York City and all throughout the country. We're seeing hotspots emerge everywhere. It may be in the South now, it may be in the West, it may be back in the Northeast over the summer, over the fall, over the winter. We're going to see this again in great numbers. We just need to be prepared. We have the tools. We know what we need to do. We missed our opportunity the first time around. We need to take advantage of it now.
So you're describing that. I mean, the psychology here, which I understand the psychology because I feel that it's tug on me as well, which is this sort of unprecedented thing happened in most people's lifespan, right? This global pandemic, we watch it sort of come to our shores. It goes through China, it goes through Italy. There's this, crazy society-wide reaction, correct, right, to sort of shelter in place and to hunker down and kind of like, get through that first wave. And there is this feeling of like, okay, well, that's receding now. And what I'm hearing from you is like the psychology of like, it's not gone anywhere. Like, how do you think about it? What is your mental posture towards the fact that this thing is still out there?
I think about it every day when I'm outside. It may not be outside in the same places in the same exact numbers, but we know that it's slipping around this country. We see images of people at the Ozarks completely, not respecting social distancing at all, thinking that this is a disease of the elderly, when in fact, people I've intubated have been in their 30s. We've seen people die in their 40s and 50s, normally, healthy people. I understand that people are fatigued with staying inside, especially as it's getting really beautiful. Memorial Day means so much. Traveling, vacation, some sense of normalcy. We need to base these decisions to open up on public health principles, on good bread and butter public health, contact tracing, isolation, the things that we should have been doing all along, but don't have the tools or didn't develop the tools to do. If we don't take that approach now, we will continue to see this virus. It will continue to infect us. It will continue to circulate amongst us, and we will have more deaths for the next few months. And really, until we have some other therapeutic or some vaccine to prevent such massive spread.